There is no question today at all, and I think the President has expressed it in great detail, that our system is broken, something must be done, and what will be done is clearly going to come through the Congress this year. If it fails, I think we have some serious problems, and we can talk about that in the question and answer period. But as I say, this will be a presentation of talking about one particular option. I want to talk a little bit about, very quickly, the history of government involvement in the health care in this country. It goes back to the beginning of our republic. It was designed for those individuals who traveled around in ships, merchant seamen, who were building the economy of this country. Because when a merchant seaman is sick in New Orleans, it's very hard for him to go back to Boston to see his primary care provider. And so the government realized if we're going to keep our merchant marine healthy and productive, we have to have a way of serving their medical needs in the communities where they find themselves when they get off the ship. We had about 290 merchant seamen's hospitals in this country up until 1982, when Ronald Reagan closed the system down and those hospitals went away. It was, in fact, the first socialized medical system to be created in the world. We did it in this country for very good economic reasons. And if Dorothea Dix had been lucky in 1854, we might have had a universal mental health system across this country, because the Congress passed legislation in 2 successive years, one to establish the St. Elizabeth Hospital in D.C., and then this next year to establish a similar hospital in every state in the Union. But that was vetoed by Franklin Pierce, and so we don't have that system. We remember that Teddy Roosevelt, having passed the Pure Food and Drug Act, wanted to go one more step and create a national health plan for everyone in this country. And if you go back and read the Progressive Party platform, you'll find a very interesting series of statements in there, one of which is that if the Progressive Party is elected, they will create a universal health system for the nation in 1912. And that was actually supported by the American Medical Association in that time, and it was fought by labor. But things changed, and we know that in the 30s, Franklin Delano Roosevelt, Teddy's cousin, tried to pass a health program with Social Security that would have then provided universal care for everybody in the country. But Francis Perkins, his labor secretary, said, "Franklin, you can't do it. The AMA is out there against us, and we don't have the votes. But we can probably get them in the next year. So let's let the health part of Social Security go by the boards for now, and we'll get the Social Security system, which, thank goodness, we all now can enjoy." But of course it took 10 years, and we didn't, or 20 years actually, until 1965. I guess that's 30 years. Until 1965, even though Harry Truman had a platform on his election in 1948 to have universal health care, it didn't come to pass. But we know that in 65, Medicare and Medicaid were passed, and we are now living with the results of that. We'll talk a little bit more about that as I go through this. The failure of the Clinton plan was a major disaster for health plans in this country, because it said to the people and it said to the Congress, don't touch the third rail of American politics. You're going to get burned. And Clinton got burned. He lost his majorities 2 years later. And so people have avoided health programs of health care over the last almost 20 years now, since, well, what is it, 15 years, 16 years. But we have a new time. We have an economic crisis. We have a medical crisis. Virtually everyone recognizes that. Many of the people who were against the plan in '93, the chambers of commerce, the big industries, other groups, even certain Republican groups, I was talking a minute ago, there's a whole website, Republicans for Single-Payer Systems. That didn't happen 20 years ago, but today it's out there. So there is a fervor today to move things forward. The bill that I'm going to talk about today in some degree is a bill that was submitted by John Conyers, the House Resolution 676, which would essentially take Medicare, and expanded. And we'll talk a little bit more about that as we go through this. But I want to cover 2 or 3 things before we get into the bill. In order to understand the system of healthcare, you have to understand these basic principles. People talk about cost, they talk about unlimited access for so many people, and clearly the issue of quality is something that we're all concerned about. Now, with regard to access problems, the numbers are very straightforward. We do not provide health care to our population. 46 million, now it's close to 50 million, or 48 million, now it's close to 50 million Americans don't have insurance. And they're unemployed. That's a bad situation. There are 50 million people in this country who have insurance, but who, when they use it and find that they're in a hospital setting, all of a sudden they don't have the coverage that they thought. The insurance company says, oh, I'm sorry, we don't cover that, and they end up with a $50,000 bill. There are 1 million bankruptcies a year from that group. 1 million bankruptcies a year. Half the number of bankruptcies in this country occur as a result of medical costs. Wait a minute, let me go back, I'm sorry. If you are unemployed and you don't have insurance, and you go to try to get insurance, one, it's expensive, but 30% of us will find that we have a precondition that the insurance company won't fund. So 30% of Americans are already uninsurable if they lose their insurance. And then, of course, the one that I find most devastating is that 25% of all children in this country are without coverage. Now, what about quality? There are all kinds of measures of quality, but I'm going to use 3 or 4 issues that relate to the health status, the quality of the community at large. One could talk about individuals, but if you look at the community at large, we're spending a lot of money in this country, and our health statistics, the quality of our health system isn't there. We are 29th in the world with regard to infant mortality. We do not live as long as most of the people in Western Europe, or in Japan, or in Scandinavia. And if you look at survival rates for the chronic diseases which take most of us away at the end of our life, our survival rates post-treatment in this country are lower than in Canada, England, France, Switzerland, Germany, the Netherlands, and all of Scandinavia, and Japan, and Thailand. There's something wrong with the system which does not provide us the same longevity and the same cancer results, or the same results after being treated for diseases as other countries. Hospital deaths, about 100,000 a year, that are preventable, that should not occur, but they occur for reasons that relate to the way our system is organized. And this is the one that just drives me absolutely nuts when I read about it. I used to say that in the United States, at least it's not like India or Africa or South America, where you can walk by a pile of rags in the morning and come back at the end of the day and there's a hand sticking out, and that pile of rags was somebody who passed away overnight. I used to say no one in the United States dies in the street. That's not true today. That's not true today. Today, last year, and the year before that, and this year, 18,000 individuals who don't have insurance, who can't afford to go to a doctor, when they get sick, will avoid the contact with the medical system because they don't have the money to pay for it. And they will die from a disease that could have been prevented had they been seen early, simply because they were afraid to enter the healthcare system.